Okay, Lauren, thanks very much. Over the weekend, the number of people hospitalized with serious cases of COVID-19 in Maryland dropped below 1,000, and the rate of coronavirus tests coming back positive is still below 4% in our state. Still, health officials are concerned about the spread of COVID-19 variants as the demand for vaccine doses continues to drop. We have WMAR2 News' Mark Roper outside the mass vaccination site there at the Baltimore Convention Center. Mark, it wasn't too long ago when getting a vaccination appointment took days or even weeks.
Yeah, Christian, long waits for appointments and long lines once you get one are a thing of the past. Now you can just practically walk right up and get a shot, no appointment necessary, which sounds like a good thing, but the lack of demand has health officials concerned.
Nearly 1 out of every 3 Americans is fully vaccinated for the coronavirus, but the head of the Association of American Medical Colleges Research and Action Institute, Dr. Atul Grover, says it's still not enough to beat COVID-19.
If we don't get everybody vaccinated, we are all putting ourselves at increased risk because variants are more likely to occur if the virus is out there replicating.
So what causes the coronavirus to mutate?
In most viruses in nature, what happens is, if you can imagine, your body gets infected, makes thousands, sometimes millions of copies of that virus as you are sick. Occasionally, some get through quality control that are a little different.
Doctors say people who've been vaccinated are unlikely to get COVID, or at least not severely ill, if they received any of the 3 available vaccines.
Generally, what happens when vaccines work well, and these work incredibly well, is that you never become infected in the first place. You don't become infected, you can't produce the virus, you don't produce a variant.
Which is why health officials are still trying to reach those people who've yet to get their shot.
The variants only occur in nature in a human host. That is, if a virus is floating out there by itself, it doesn't just change. It requires a human being in which to replicate and change. So the faster we can get people immunized, the less chances we have of those new variants popping up across the country.
Millions of people got vaccinations to protect themselves against COVID-19, while many others have passed on getting vaccinated, with some believing they'll be protected by herd immunity. And Dr. Grover offers people with doubts about the vaccine something else to think about.
Even if you don't do it for yourself, if you don't do it for, your family, you don't know what your next year is going to look like. You may become immunosuppressed. You may need a kidney transplant. Those are the people I really worry about out there, even if they are vaccinated. They are the most vulnerable.
Now, Dr. Grover says the 3 vaccines do work against those variants, and he says the sooner more people get vaccinated, the less we'll have to worry about those variants. Reporting live in downtown Baltimore, Mark Roper, WMAR2 News.